All right, 5 minutes late, that's not bad. I was doing another interview from my cup, another video, so I'm so sorry, it's a few minutes late. We have 5 speakers today, so we are going to get started pretty quickly. But this is the state and federal update session. We do this every year at every conference, just to give you state and federal updates. This year we added a couple updates from Main Street, the governor's office, and SHPO, as well as Joe and I will be doing state and federal DEP and EPA updates. First up is Jennifer, and then we'll get going.
Yeah. Thank you. Hello, good afternoon. We have a few other exciting things going on in the state at the state level, so we thought it would be a good opportunity to kind of get the word out about some of the initiatives that are going on. From a Main Street, I am Jennifer Brennan. I'm the West Virginia Main Street and On Track coordinator. So from the Main Street perspective, just wanted to tell you a little bit about what's happening in our office. Every year, the Main Street directors are required to submit annual statistics to our office, which we then submit to the Main Street America office. And in 2022, 10 West Virginia Main Streets reported 213 jobs created, 53 new businesses, 198 building rehabilitations, and $10 million in private investments. That's one of the largest years that we've had. So we're very proud, especially of the job creation that we've seen this year, as well as the new business creation. Main Street West Virginia Main Street has just completed our strategic plan for the first time in several years. And so we will be releasing our updated strategic plan by October 1st. We just have a couple of odds and ends left to add. And we are also accepting new on-track applications. So that is something that we have been asked for several years. So we are now accepting new on-track applications. So if you have any questions about that program, feel free to touch base with me. Also, the Department of Economic Development is the housing station, I guess is the best way to phrase it, for a new program specifically for housing. It was created by the governor's office, and it is called Build West Virginia. And they sent a couple of points that they wanted me to touch on. It is a tax credit that can be used against corporate or personal net income tax for 10 years for the creation of housing units. So if you create 6 new housing units or spend $3 million, you are eligible for a substantial tax credit. The program provides incentives for housing developers that build qualified projects in certified Build West Virginia districts. The intent of the program is to address housing needs in key areas of the state and to also address the cost constraints of building housing in West Virginia. Legislation passed earlier this year helped expand the program by removing the limit on the number of Build West Virginia districts. And we currently have Fayetteville, Martinsburg, Davis, Franklin, Clover Lake, Buffalo, Parkersburg, and Wheeling as the districts. And they are accepting new districts. So if you live in an area that might benefit from the Build West Virginia program, I would recommend contacting the Department of Economic Development. Developers within 20 miles of each of these areas may have access to the incentives if they submit an application and are approved. Tax incentives include a sales tax exemption on purchases of building materials and a tax credit that can be used against corporate or personal net income tax for 10 years. So that is a pretty substantial tax incentive if you are a housing developer. So if you have anybody who might be interested, I would recommend finding out more about that program. I'm going to go ahead and turn it over to Ben Riggle. Ben is with the State Historic Preservation Office, and he's going to provide some updates on Section 106 and some other programs in their office.
All right, I'm Ben Riggle. I'm the senior architectural historian responsible for Section 106 reviews with the State Historic Preservation Office here in West Virginia. For my first update, I'll get the deadline out of the way. Our survey and planning grant deadline is coming up October 31st. So if you're interested in applying for that, make sure you have that in before Halloween here. We've also switched over to an all virtual tax credit submittal system. So if you're working on tax credits, no more worries about paper copies. You can do digital submittals with our office. Assuming the tax credit is successful digitally, we are going to switch over to Section 106 digital policy as well. That's still a ways away, but we are working towards that. So hopefully we can get away from having so much printout stuff. Now for the more policy type updates. The ACHP released a new policy statement on burials, human remains, and funerary objects. This is pretty important in our state because we've not had great history in dealing with some of our remains. So if you happen to have a project that will deal with that, I recommend you check out the ACHP's website. They provide details on tribal notifications if you're dealing with Native American remains or other groups if you come across any of their burials. Now for some brief updates on brownfields projects that we've been working on. One of the big successes I think is doing pretty well is the Brook Glass Factory down in Wellsburg. That was an adverse effect that we worked with them to help mitigate. So they were able to demolish some of the buildings that they didn't need anymore, even though they were contributing resources. We were able to work with them to develop mitigation strategies. The American Car Foundry over in Huntington, next to the Marshall campus, is another one where they're working on developing that into in relation with Marshall as well to develop like a student type center. Where they had to remove some of the hazmat buildings that were filled with hazmat materials, but they're able to salvage some other ones, and we've been working with them. We've also got 2 solar projects starting up, Black Diamond and the Ravenswood Solar Project out near the Century Aluminum plant where the Brownfield is out there. So there's plenty of opportunities. We enjoy working with everybody and the developers that would like to use a Brownfields to develop something else. Don't be feared if it's a historically significant resource, because we can work with you, help identify the most significant portions and deal with any kind of mitigation strategies that might come up as need be. That's pretty much it for the state side for the updates. I'll be around if anybody has any Section 106 questions, any review questions about that. I'll be glad to help answer them. Feel free to shoot me an email as well. We're a really friendly office and we're glad to be working with all of you. I'll turn this over back to Aaron.
Anyone from the Brownfields Assistance Center? The presentation? No? Okay.
You want to go when you guys get this stuff worked out?
Yes. This is Rob Rice. He is here for to give a quick governor's update, and he is also DEP's Division of Land Restoration Director and Deputy Cabinet Secretary. Rob.
Thank you, Aaron. So I'm going to try to actually use this while they get their presentation found. So appreciate everybody coming here today. I just wanted to give a quick update from the governor's office. So when the infrastructure law passed, then that was followed up with the CHIPS and the IRA. So what the state and federal agencies found themselves with was a pile of grants that just kind of got dumped on us all at the same time. So everybody's heads has been spinning for the past year or so. And, you know, one thing that Governor Justice has been really emphatic about is that no money is left behind. So there's been this big push to really kind of collectively figure out what all grants are out there, what grants are available, and, you know, how to make sure we really secure those dollars for West Virginia. So the Region 3 director, you know, had people raise their hands and ask about nonprofits, community leaders, so forth and so on. And what we found in going through these grants is the vast majority of the grants that have been made available are really directed toward communities and nonprofits. So what the governor's office has done is created an infrastructure hub. And so if you just Google West Virginia Infrastructure Hub, you'll come to this website that's behind me. And it's got a couple neat features. It's still being, it's a work in progress, so it's not done. If you notice anything that's not working, we definitely want to hear that, what's not working for you. But I just want to point out a couple things with the website. So, we're here on the home page, and as you scroll down, it talks about the money that's available, but the NOFOs. So one thing that's kind of hard for everybody to track is to know, what grants are due and when they're due. And so part of what the website will do for you is just let you know what all is out there and what you can apply for and when those deadlines are coming up. So that's a really quick and easy way to learn, what's out there that I could apply for. So, and then we also have an opportunity tracker, and this is just a dashboard that shows, some of the work or the grants that are out there and that have been implemented around the state. It's divided up into categories, and then we go from there into 2 different dashboards that show, it's divided up between the infrastructure and then IRA, and these are different locations where dollars have been deployed already around the state. This one, the IRA, it's a little bit newer. We're still trying to kind of wrap our head around, what grants are out there. So this is going to be something that if you continue to go back to the website, there'll be more updates that will be made as we can do so. I'm going to go back to the opportunity tracker here for just a second. So what you'll notice on the right-hand side, you can search. So if there's something that you want to search for, the keyword, the agency, maybe it's Department of Interior, maybe it's EPA, you can use that to kind of help filter what it is you're looking for. So if you notice on the home page, it had the NOFOs that are coming up here in the next, 6 to 8 weeks. If it's something that's out there a little bit further, go ahead and search for those grant opportunities, over here on this website. One last thing that I'll point out, environmental justice has been something that's really been a big push with these new initiatives. And then I think it's on this tab where we have, yes. Okay. So one thing you'll notice, all of the gray areas on here, these are the counties of West Virginia. These are going to be, Justice 40 qualifying communities. Now, there's a dozen different tools out there. So if your grant is really targeted for one of these communities, but it doesn't show up on the website, probably okay, because if you dive into some of these communities that aren't identified, if you look in the right area in those communities, you can find areas that do qualify. So I was asked 2 weeks ago to come up here and talk about this. And so I replied back, what do you want me to talk about? Didn't hear anything until an hour ago. So I had no preparation. And to be honest, I kind of forgot that I was asked to get up here and talk about this. So I do have a QR code on my iPhone that will allow you to get, I think, automatic notifications for the NOFOs that are out there. So anybody that wants that, come see me. I'll hold my phone up. You can scan the QR code, and then you should be able to access the website and get those updates as well. That's all I have for you right now. So anybody have any questions about the website or any of the opportunities or how to use the website? All right. I'll be around today and then tomorrow. Again, find me. I'll give you my iPhone, you scan the QR code, and you'll get set up to receive these notifications. And again, we really want the communities and the community leaders and the nonprofits to get engaged, because the state and federal agencies don't have the capacity to go out and find you and tell you which opportunities are suitable for you. So we really need you to actually, start looking at some of these. If you have questions, call us. I'll give you my cell phone number. So if anybody wants to write it down, or if you want to type it in your phone, my name is Rob Rice, R-I-C-E. My cell phone number is 304-389-7602. Again, that's 304-389-7602. If you have any trouble with the website, or you're trying to figure out, whether you qualify or not, give me a call. I probably can't answer your question, but I promise you I'll get you to the person that can. So, is Joe next?
I'm next.
You're next. All right. Next up is Aaron Britt. Thanks, Aaron.
Perfect. Thank you, Rob.
We have your presentation.
Yeah.
I could plug mine in and do mine.
Yes, I have it on my computer, and I can plug my computer. Sorry, folks, just 1 second. Any help from Carrie? No?
She was gonna go try to figure it out on her computer.
So while they're doing that, I can continue to kind of navigate through the website a little bit for entertainment value. So if we go back to the opportunity tracker, one thing that I noticed today was it looks like, at least as far as we know, let me see, let me go to the keyword. So if you search for brownfields, this has got all of the known brownfields grants that are out there. One thing you'll notice, the NOFO date has passed on all of them. So unless we've missed something, it looks like all of the brownfields type grants, those NOFOs for this year have come and gone. But if any of you know brownfield grants that are still out there and available, let us know. We want your feedback on the website. And Joe, I can stop talking anytime you're ready to jump up here. So just, the keyword search is a great thing to do. Again, I'll go back to the dashboard. Same thing, you can select by category. So we'll just select broadband. Broadband's been a big initiative here in the state. And so we've got the green dot here in the middle. Click on that. And so we've got the middle mile grant program. We go back to our home page. Again, this is going to be where the notice of funding opportunities have been made available or posted. So it looks like these go out, to the end of the month. Krista Cox with the governor's office will continue to update these, and that'll feed into this website. So if you check back once a week, then you'll see those new NOFOs. But again, if you find me and you scan my QR code, then that should allow you to receive those automatically. I can keep talking whenever you're ready, or if you want me to keep going, I can.
You keep talking while I'm on the computer.
Okay,
Vamp a little bit.
so, all right, does any community leaders in here, any nonprofits in here? All right, is there anything in particular that you're looking for? Okay, yeah, so on the Solar for All, I saw that's actually one of the NOFOs that's coming up here soon, and if somebody sees it on here, point it out, but I did see it on this list. So yeah, so application, Solar for All funding opportunity. So this will take you to grants.gov, and then you can dig into all the information associated with it. With this particular grant, I think the governor's office is working with Solar Holler and maybe a couple other Coalfield development. And so I think they're going to be the lead, with the state signing on as, a supporting member. But that one should be, I guess 6 to 9 months from now, we should be able to kind of move forward with the solar type projects. But if you need more information, we can certainly, try to figure out whatever it is you need to know. There was another nonprofit hand back there. Any questions on grants that would help you out? No? All right.
Thanks again, Rob.
Sure thing.
I don't know what that means.
Sharing the screen.
Yeah.
Yes, hand for Carrie. Thank you so much. Sorry for the technical difficulties today. Well, good afternoon. Thanks again for bearing with us through all the technical difficulties. I'm Erin Britton. I'm the Brownfields Program Manager for the West Virginia DEP. Today I'm going to be discussing program achievements for the Office of Environmental Remediation, or OER, the office that the Brownfield section works out of, as well as a few programmatic updates. All right, the DEP's headquarters is in Charleston with multiple regional offices throughout the state, employing over 700 people. The agency's vision is a fully protected and healthy environment where every West Virginian can live, work, prosper, and enjoy a high quality of life. DEP has several primary divisions, and one of those divisions is the Division of Land Restoration, where Rob and I work out of. The Office of Environmental Remediation is housed within the Division of Land Restoration. Our mission is to provide for clean, safe, and productive West Virginia communities by assessing and remediating environmental resources and restoring contaminated properties to beneficial use. OER administers several environmental cleanup programs, most of which stem from the Comprehensive Environmental Response, Compensation, and Liability Act, that's a mouthful, or CERCLA, or Superfund for short. These programs include the Brownfields Assistance Program, Voluntary Remediation Program, a risk-based leaking underground storage tank program known as the UELS program, Superfund program, and Federal Facilities Restoration Program. West Virginia DEP is led by Cabinet Secretary Harold Ward, which hopefully everyone was at lunch and saw him speak earlier today. The Division of Land Restoration is led by Director and Deputy Cabinet Secretary Rob Rice and Deputy Director Casey Corbini. I have an amazing Brownfield staff, and the Superfund Program Manager Jake McDougall has an equally amazing Superfund staff, as well as the best technical and administrative team around. I'd like to also point out a few changes to our team since last year. Jackson Porter is a new Brownfields team member, and Frank Lewis is a new Federal Facilities team member. And I don't know if they're in the room. I don't think they are, but for the DEP staffers who are here, could you just raise your hand and show everyone? Thank you. Right in the middle with the green shirts on, of course. If you didn't know that. All right, yeah. All right, so the first OER program I'd like to highlight today is our Brownfields Assistance Program. OER empowers communities, developers, and stakeholders to assess, clean up, and sustainably reuse brownfield sites. We provide free guidance, yes, I said free, and technical assistance throughout the brownfield redevelopment process, and we assess properties that are contaminated or perceived to be contaminated throughout the state. And of course, we partner with the West Virginia Brownfields Assistance Centers at WVU and Marshall University to provide maximum support throughout the state. We also review phase 1 and 2 environmental site assessments and then explain the results through technical and programmatic guidance. We can assist communities with public outreach and training, as well as introduce similar successful projects to communities and have identified potential brownfield sites. OER also helps plan and present information at annual grant writing sessions, and so that we can help identify potential funding sources for those individuals. Our services are free, like I said, and available to anyone assessing and remediating brownfield sites in West Virginia, including government entities, nonprofits, and private developers. All right, one funding opportunity OER pursues is the same one that many of you also pursue, and that is an EPA Brownfields Assessment Grant. OER has been awarded over $3 million since our first assessment grant in 2009. The funding is used to perform assessments typically within a target area and often assist stakeholders with an immediate redevelopment opportunity. We have just completed our Chemical Valley $300,000 assessment grant, which totaled 18 phase ones, 12 asbestos inspections, 9 lead-based paint inspections, and 3 phase twos, totaling 42 assessments altogether. Some of the sites we inspected in the Chemical Valley were the Stats Hospital, the Union Building, and the Courier Street Building in Charleston, the former Central High School in Point Pleasant, the West Virginia Regional Tech Park in South Charleston, the Mason Splash Park in Mason, and the Longacre site in Smithers. And at last year's conference, I announced that OER was going to receive a $2 million EPA Brownfields Assessment Grant in October last year. And I think when we applied for this grant, I remember George Carrico saying that's going to be a game changer, and it really has been. We've worked pretty hard over the past year since we received the $2 million assessment grant. So in 1 year's time, we have completed 22 phase ones, 4 phase twos, 4 phase threes, 14 asbestos inspections, 11 lead-based paint inspections, 3 radon inspections, 5 mold inspections, and 3 property condition assessments. And if you didn't do that math in your head, that total 66 assessments. Like I said, we have been really busy and so thankful to EPA for that $2 million grant. So I'd like to take a few minutes to highlight the good work that some of you are doing at these sites as well. The Arthurdale Heritage Organization is rehabilitating the Arthurdale schools in historic Arthurdale. These are some of the pictures there. We provided asbestos, lead-based paint, and mold inspections at 3 different school buildings in Arthurdale. The city of Bluefield also has redevelopment plans for the former Mercer Nursing Home facility. We had several assessments completed there for the city, including a phase 1 ESA, asbestos, lead-based paint, radon, and mold inspections. And I love that picture where someone had vandalized. Why me? All right, this one, the Mount Zion Church in Fairmont would like to redevelop the former church into a center of hope. And I know that's something we have spoken about a few times already today about how Brownfield sites offer hope for these communities throughout West Virginia. So the church, when they came to us, they said the site was donated to them on condition that they use it to serve the community. They are hoping to restore this beautiful building to provide academic and enrichment activities for the community. We also had several assessments completed there, including phase 1, asbestos, lead-based paint, and mold inspections. And I've often driven by that church thinking, what will it end up being? Because it's like literally in the side of a hill. All right, moving on to the Harmony for Hope site located in none other than Mount Hope, West Virginia. This building sits right on Main Street. And as you can see from some of the pictures, a building adjacent to this one burned recently. We're hoping that the Harmony for Hope folks can redevelop these buildings on Main Street soon. We completed a phase 1 asbestos and lead-based paint inspections for them. All right, and last but not least, this is one of our favorite sites that we like to, and Eileen Johnson is the former executive director at the Hampshire County Development Authority. They're in the middle of the room. Thank you for coming, Eileen. And I still need to meet you like officially in person, but I will after this one. So this is the former Hampshire Memorial Hospital site in Romney, West Virginia. We provided a phase 1 to the Hampshire County Development Authority because this site will soon be transferred to the Hampshire County Board of Education to build a new elementary school. OER's Brownfields Revolving Fund Program also provided loan and subgrant funding for this really exciting project. And speaking of the Brownfields Revolving Fund Program, So in 2016, the revolving fund program was capitalized by an EPA revolving loan fund grant. The Brownfields revolving fund offers low or no interest loans for government entities, nonprofits, and private businesses. We've awarded nearly all of our funding for the Pinwheel enclosure site, Hampshire Memorial Hospital site, and Morgantown smokestack sites. Because we were low on funding, we applied for a $1 million supplemental RLF funding earlier this year. We were successful and will be receiving that supplemental RLF funding in October, in just a few weeks. And for more information, just a little plug here, please come to our RLF session tomorrow at 10:30, where we will be highlighting this program as well as Huntington and Weirton's RLF programs. And another grant that OER has received for several years now is the EPA Small Community Technical Assistance Grant, which is what we all talked about through the cabin presentation this morning. We can apply for one of these grants per year on behalf of a small, rural, or disadvantaged community. The grants allow for community engagement through training, research, inventorying brownfield sites, and site planning activities, such as creating a master plan or market study. We've completed successful projects in Smithers, Mullins, and Milton so far. We're currently working on Mannington, and we're about to kick off our next project in Logan and West Logan this fall. We're pretty excited about that. All right, so sites that have been determined that have contamination during the assessment process may enter the West Virginia Voluntary Remediation Program, or VRP for short. The VRP was established by the West Virginia legislature in response to the growing number of brownfield properties after passage of CERCLA. The VRP encourages applicants to voluntarily develop and implement remedial plans at contaminated sites without the need for enforcement action. VRP provides oversight of remediation at brownfield sites and ultimately provides liability protection to those performing the remediation with a certificate of completion. The VRP is recognized by EPA through a Memorandum of Agreement, or MOA, as a state response program as defined by CERCLA. Note the pictures on the right are of the Wheeling Island Gateway Park and the Robrecht property, which are two sites currently in the VRP, and I think those were showcased during the mobile workshop yesterday if you attended that. I think it was the Nailed It session. So this is something we're super proud of in VRP. We've been extremely successful for encouraging voluntary remediation of sites that could otherwise be abandoned for decades. Since its inception in 1996, the program has issued 256 certificates of completion, which certifies remediation is complete and provides formalized liability protection. And in total, 4,174 acres have been remediated through the VRP, and they are ready for redevelopment. But I like to highlight recent certificates of our VRP sites that have received certificates of completion at the conference each year. So one recent one was the McGinnis Building site in Huntington. And as you can see, the site will be a part of the new Marshall Baseball Stadium. After completing VRP requirements, a certificate was issued in December last year. And that's a really exciting project. Not only this site, but also the ACF site will be a part of the baseball stadium and other redevelopment opportunities. And another project that received a certificate was the Kittis site in Ranson, West Virginia. This site was issued a certificate just in June this year. DEP's videographer, Mike Huff, produced the video that I'm about to share with you all. And he always really likes to do brownfield sites because they're happy things that DEP does. Let me see if this will work. Oh, well, it looks like the video is not working. Sorry, folks. So, if you go to YouTube, the West Virginia DEP Environment Matters has a brownfields playlist, and it actually lists all of the brownfield sites where Mike has done videos for. There's a lot of them, but the Kidda one he did pretty recently, and there was some community members that had seen the site be like the picture on the screen for decades. And so the community member gave a heartfelt interview to Mike, that he was so excited to see this site get turned around. I encourage you all to go onto YouTube on the Environment Matters website and look up this video. It's really heartwarming, and it really gives us a sense of purpose that we're doing good things here in West Virginia. All right, and so congratulations to both of those sites that I highlighted. All right, so I also want to highlight some of the things OER participated in since we met last year at the Brownfields Conference. As I mentioned earlier, DEP assists the Brownfields Assistance Centers and EPA to hold grant writing workshops every year. The picture on the right shows me along with Mayor Ann Cavalier from Smithers, and two Ohio neighbors, Roxanne, who was also at the cabin panel this morning, and Crystal from Bel Air, Ohio. We were lucky enough to have our session chosen at the National Brownfields Conference in Detroit this year, and we shared our stories of successful small technical assistance grants in Bel Air and Smithers. And Marianne really was just the rock star of that entire conference. All right. We are also toured the city of Mannington for the Small Technical Assistance Grant Project with the Brownfields Assistance Center staff and the mayor of Mannington. She treated us to pizza during the tour of Mannington, and so the pizza place is called Big Mama's. You have to go. It was delicious. And I can't wait to get back there and have more pizza.
And the Big Mama is what you want.
Yes, of course. You want the Big Mama pizza at Big Mama's. All right. Our OER team also held a staff meeting at the Bradley Prosperity Fire Station in Mount Hope in June this year. Thanks to our very own Alan McCreary, who is a volunteer firefighter there. We watched a fire suppressant demonstration with firefighting foam that was PFAS free, and it was amazing. I think all of us at OER were just amazed at how quickly this PFAS-free foam put this fire out. We don't know what was in the suppressant, but we won't go there. That's our next 20-year, emerging contaminants.
Not yet emerging.
Yes, exactly. We will talk about that. And then finally, DEP staff met with EPA Region 3's Regional Administrator Adam Ortiz for the announcement of our supplemental RLF funding in Berkeley Springs at the Alex Rickley Memorial Soccer Complex, which also was in the VRP and received a certificate just a couple years ago. It was a great day, just a beautiful day. If you don't know about that soccer complex, please Google it. I will start bawling if I talk any more about it, but please Google Alex Rickley Memorial Soccer Complex in Berkeley Springs. It's worth looking up. All right, and I have just a few quick updates to share today. We're again trying to update our Voluntary Remediation and Redevelopment Act, or VRRA, with the bona fide prospective purchaser, or BFPP option language, to provide maximum brownfield support and service for redevelopment options throughout the state. We are currently working with the West Virginia legislature to hopefully get this updated. We've tried 3 or 4 times, so everyone please give us good juju to get this passed in the 2024 legislative session. We will not be updating the VRP de minimis table this year, but we will likely definitely update it next year for lead and possibly a few other constituents of concern. And currently our guidance manual, our VRP guidance manual, is being updated, which I think we talked to the LRSs yesterday about that, and should be released shortly after the conference. All right, so wrapping up, I just wanted to show our website. It's recently been redone, and I think it's beautiful. And I love this picture there when you go to the main DEP website of all the different branches of DEP and the good things going on. we are again in the division of land restoration. So if you see where at the bottom there, there's air, land, water, and waste. That's just a few of our main divisions. You can peruse our website. OER has a ton of good material and resources on our website, especially on our technical guidance page. I do encourage you all to go to our website, and if you have any questions, or contact me anytime. We have offices all throughout the state. We can always come and look at a Brownfield site if you contact us. Those are all of our email addresses, or you can find any of us and ask for a business card, or call the main line and ask for us as well. But I thank you for your patience to get started today, and I appreciate your time. Thank you. And up next is Joe Novak with Region 3 EPA. He is my project officer. I could not do half as much as we get done without Joe and his support. And he is up next. We just need to get his PowerPoint up. Thank you, Karen.
Sure. Coming out.
Great, thanks, Aaron. Okay, so everyone has heard, we're going to be releasing our Brownfields grant guidelines pretty soon. It could be as early as this week, next week. I mean, it was due about now, so usually we
3 minutes ago, not yet.
yeah. Usually we start hearing a little bit more chatter about when it's kind of approaching or something like that. There could be a release date or something. So I don't think there's been any chatter yet. So, may not be this week. It may start, more likely be next week. But anyhow, these are some of the estimates of the numbers that we're looking at for this year, and it's all kind of pending, what the budget is actually going to be set for. So, we're going to be offering multi-purpose grants, the 3 separate assessment grants, community-wide assessment coalition, and the CWAG Street or assessment, state assessment grants that Aaron was talking about. There's not going to be any new RLF grants awarded this year, but there is going to be a supplemental RLF for high-performing current RLF grantees, probably in the February or so timeframe. So the maximum grant awards have increased. So multi-purpose moved up from $800,000 to $1 million. Assessment coalitions really jumped up. They went from $1 million to $1.5 million. And cleanups, we've had the usual 500,000. Last year we introduced 2 million. And then this year, they're looking at awarding $5 million cleanup grants. So one of the important things to remember with the $5 million cleanup grants is you only get one grant, but you can bundle sites. So you can clean up as many sites as you want. The bad thing is you kind of have to also bundle them into one application, so that could make things kind of difficult in terms of squeezing information and data in there, but, you could maybe still do it. So, those numbers again are estimates as far as, they're looking at 8. Hard to say if they're going to award that many or not, but if you recall, like last year, I think they were talking about awarding 8 $2 million grants, and they ended up awarding a lot more. So it kind of depends what comes in, what the interest is, and where they want to shift the dollar amounts to. And that's why these things are all, really just estimates. There are no site-specific assessment grants. There were none last year, so that's one of the kind of newer things that we dropped off. So we're just kind of encouraging you really just apply for a community-wide assessment grant, which you're better off, because if you didn't get access to that site, then you couldn't spend any dollars someplace else. So this one really achieves the same thing, and you have more options if you wanted to. The community-wide, you kind of notice there are new and existing, and that terminology is for grantees. So new are entities that never received an EPA grant or that were awarded a grant that closed in 2015 or earlier. So you're sort of back a couple of years. And then the existing grantees are the ones that are current or 26 and later awarded. So again, the other thing is there is no cost share this year. You can see like anything that's bill funded is loaded into those things that previously perhaps required a cost share to eliminate that aspect. Hey, as in recent past years, we're also going to continue to offer some free technical assistance. So some of these, I think we're expecting some additional funds to get loaded into the contract. Pretty soon, it's supposed to be about mid-September or so. So we may be, asking, and this is really geared toward current projects or current grantees that maybe went through a cleanup or a targeted brownfield assessment and maybe need some type of additional assistance to get your project to reach that success story. So we're doing one for Marvin right now at the Brook Glass site. We've kind of done some for Park Drive. We've done, other aspects in West Virginia as well. And in the center there is the technical assistance to brownfields. So again, we are in the process of awarding $5 million to West Virginia TAB to provide assistance to communities for the next 5 years. And one of the bigger things is they're also now partnering with other universities. So we have Marshall, Virginia Tech, and University of Delaware also coming on board to kind of spread our reach throughout the region. And also that last column are targeted brownfield assessments. Those are where these aren't grants, these are where EPA provides phase 1s, phase 2s, and cleanup efforts with our dollars. It's our contractor, so these aren't really grants. This kind of really helps you if you're applying for a cleanup grant next year. You don't have any assessment dollars, and you just have one site. You can kind of move quickly, hopefully, to that next stage to kind of get something awarded next year. And we just, awarded a new contract within Brownfields to have a new contractor just work with us. So we're hoping that can kind of help expedite some things as well. As far as the FY24 competition, there's a website that has info of where all this stuff is going to be posted. And, we're anticipating the due date to be November of 23. So it's typically a minimum of 60 days. So if it's next week, they'll probably add a few days or something like that in between when the posting officially goes out. One of the other reminders that's up there is grants.gov is going to have that maintenance schedule posted on their website, but they're looking at going offline November 18th and coming back online on November 20th. Yeah, so we're gonna try to avoid that, but if it's like Tuesday or Wednesday, it might be worth just getting it done that Thursday or Friday prior, because there could be a big influx of people coming in that last 2 days or something. So make it November 17th. There's going to be a national webinar at some point. That date's still to be determined. So I think once these things get posted and we kind of get a little bit better online in terms of the training, get that stuff set up, we'll let you know as well. And here's some reminders on submitting the application. The Appendix 1 of our guidelines gives you information on that submittals. Again, you need to be registered on both SAM.gov and grants.gov. So there's links there as well on our website that leads you through all that stuff. Last year was that old DUNS number was replaced with what they call a UEI, which is a unique entity identifier that's used by SAM to identify businesses and other entities that do business with the federal government. So there were some issues with that last year, and I don't think we're anticipating that this year. So hopefully some of that stuff is going to get resolved. And finally, EPA is no longer providing flexibility to these applicants with challenges related to COVID-19 and any submissions issues that you may have. Some of the orange text is kind of highlighted last year. We're bringing it up again. Regional councils are those established under a governmental authority. There's some language about land banks as an example. And I can kind of get into that a little bit. So if the land banks an agency or an instrumentality of the county government was established pursuant to state or county law, it would be eligible to lead the coalition. You know, provided the county or whatever didn't apply as well. An independent nonprofit land bank would not be eligible as the lead. So I think this might affect somebody like the West Virginia Land Stewardship Corporation, and I know they're going to be probably applying. So each case is very specific, and I think we just kind of need to look at those aspects, you know, with each applicant. 501c6 organizations can apply for cleanup grants. The 501c3s can apply for cleanup and other grant types. And there's going to be a little bit more language as far as the 501c4s this year. You know, though it was out there, but kind of hidden, those that lobby the federal government will not be eligible. So I think this might become a little bit of a more of a threshold issue where we want you to provide that language in your threshold. Okay, the cleanup grant, site characterization and letter from your state requirements from last year kind of remain in effect. So cleanup applicants were asked to review this threshold criterion and provide a response to the sections that pertain to their circumstances. So I think this year, the date for sufficient characterization is going to be June 15th of 24. And the letter must clearly indicate that the information for this grant application and not a previously submitted application for those that failed. And we're also providing a template for states to use for these letters as well. So, and a reminder, this letter is in addition to your support letter. So that's kind of tripped up some people where they got a support letter, but then forgot to get this site characterization letter. So it's very important. If you're thinking of applying for a cleanup grant, I would recommend reaching out, you know, to Aaron or Brownfields Assistance Center. So you kind of, you know, on the radar to get this thing and, you know, it doesn't get lost in the shuffle. Okay, this slide really just pertains to West Virginia DEP. You know, previously entities that were awarded these CWAG Streets grants were not eligible to apply for additional assessment dollars. So this year there's a 70% drawdown rule. So I imagine this thing will continue in future years. So with this current $2 million grant, when you reach that 70%, you know, drawdown, you'll be able to apply for additional dollars. There's going to be a threshold update this year related to procurement. A lot of this stuff has been kind of floating around. As before, contractors, including consultants, must be selected in compliance with the fair and open competition requirements, regardless if the contractor was procured before or after the award. So if you've got a contractor on board, I think we may be asking you for more additional information or confirmation that you've met, you know, that fair and open competition requirement. So if you already selected a contractor, but the procurement process did not incorporate the factors outlined in these grant guidances, then the process you completed to select the contractor may not be compliant. And then what we would do is ask you to stop work and recompete that, in essence, to get in line with those compliances. So you'll be issuing a new RFP. And again, I think we have fact sheets on this thing, and I'm not sure if that's a link or not, but I think, you know, we can provide one, or you can kind of Google it as well. Okay, so in addition, there was this new guidance that came out last fall, and it may have been too late, you know, to reach our guidelines last year, and nobody kind of said anything about it. And then when it was time to do our awards this year, our grants office flagged this thing and said, we have to be in compliance with this aspect of construction versus contractual. So on our SF 424A budget form, there are categories, both of these categories, contractual and construction. And we've never used the construction aspect before, but now this requirement has changed that. So there is this definition that's in bold in terms of what construction is. And a lot of this had to do with Davis-Bacon, and I guess the bigger picture of how the government, accounts for, construction efforts, which were previously, hidden inside of contractual as well. So building or repairing facilities and related demolition and site preparation work for remediating contamination is now going to be classified as construction. And those AE services are going to be classified as contractual. And construction activities carried out by the applicant, meaning you or your employees of the grantee only, are going to be classified personnel. And that's not really new. That was always the case. So if you wanted to do, if the city applied for a grant and they want to use city workers, you could rent equipment, but the city workers were to charge, the personnel category. So how did EPA deal with this thing in such a short term? There is no formal guidance out yet. I think the attorneys at headquarters are working on this stuff, but this was sort of the compromise or aspect that we're marching forward with. And I think this is going to be in our guidelines this year. In summary, what's going to drive the cost classification is the principal purpose of the contract. So if the majority of the work or activities are construction activities, it's going to be recorded as construction. And if it's other than construction, then it's going to be in that contractual category. So what does that mean for us as far as your application goes? For the most part, if you're applying for a cleanup grant, you're going to put your dollars that were previously contractual into the construction category. And assessment grants are going to fall into the contractual category. So even if you were to pull a tank under an assessment grant, it's still minor effort overall, and it still would be listed as contractual. And if you're doing some kind of AE services or things like that, cleanup planning efforts or something in a cleanup grant that would have been, previously contractual, it would still be counted as construction. So it kind of made it pretty simple to kind of understand. And then finally, this is kind of what our Brownfields team currently looks like. Susan's position has been elevated to include pollution prevention, sustainable materials management, and program support. So the Brownfields has become a section with that section chief. The position is currently vacant. Also, if you haven't heard yet, Mike Torino is going to be moving on to Region 9, working out of Flagstaff, Arizona. And I think it's going to be that first week of August is when will be his last week here. In the meantime, since last year, we've also picked up Chris Lesniak and Nancy Shannon. So Nancy is going to be managing the cleanup in Pocahontas County and the current job training grant to Coalfield Development Corporation. Craig is managing Wayne County Economic Development Authority. And he's also doing cleanup of the Morgantown Utility Board, the former Dinsmore site in Morgantown, and also the Harrison County Economic Development Corporation assessment that we're getting ready to award. So both of them came from private industry, Nancy from Tetra Tech and Craig from Weston. So we've got a lot of experience. And if you've got any other questions or something, you can see Susan, Sydney, or myself at the conference. And that wraps it up for me. I guess if anybody has any questions.
Let's see if we have any online.
Okay. And Karen has some LRS certificates to hand out for those of you that require.
LRS certificate, I'm gonna be right here. Please come see me after questions. Session.
All right, because I can yell. I can project a little more than this. I'm Candy Elliott. I'm a professional geologist in North Carolina. I work for SCS Engineers. SCS has offices all over the country. My colleague, Dave, back here. Hi, Dave. He's in the Pittsburgh office. And so today I'm going to be looking at the economic, climate, environmental justice tools specifically. And this is Christian.
Hello, good afternoon. Sorry to keep you from nature. Everybody was outside, hopefully. My name is Christian Abilto. I am currently a faculty member at WVU in the School of Public Health. Sorry, is anybody here from West Virginia? Reading the news? Okay, yeah, so that's the joke. I'm currently employed by the university. Right, there we go. Thank you. I'm living that joke every day. Yes, it's not good. So I'm going to be talking. So Candy's starting us off, and then I'll talk afterward. We're going to introduce you, hopefully in an enjoyable way, to some data tools. You'll go out and search and find things. I'll be introducing you to some health data sets and why you need them, and also community health needs assessments and how to go find one that may be applicable in your local area. But first, we're going to see if we can make something work here. A poll. All right, grab your phones. We're going to try this. Possibly. There we go. Oh. Just go ahead and hit that QR scanner to see. We just want to get an idea of which of these data tools you've used before. Of course, it's too big for the whole screen.
Of course.
The results. That's all. Oh, sorry.
I think that was just the.
Off to the right.
That was you.
This is an anonymous poll.
So this is going to make it easy for me. You guys know all this stuff.
Share this screen. And we're going to juggle some screen sharing up here with our Zoom friends. If there's anybody out there, yeah, you got to get real close. Dang. All
I
right.
do. It just wouldn't take it, but it did on that.
There you go.
Open and browse.
Well, don't go too far because there's another one. There's another couple coming. Okay. Census data tables. Wow, they know the pain of that. We got 11 participants. EJScreen. Awesome. I get to introduce you to some new stuff. Okay. Cool. We've had 11 vote. Any others? All right. Okay. Next. Oh, wait a minute. 2 more. Anybody else still in there? Going once, going twice.
So
Okay, so census data and EJScreen, city health. All right.
excellent.
All right. I get to intro. Okay. My talk's going to be more fun than yours.
Of course it is. Of course it is.
Okay, next up. Is anybody online?
Huh?
Oh, yeah. You know what it won't show is whether, does anybody not know anything about these? Health needs assessment? Okay, that's what's not in the voting.
That's
Okay,
what's-
that's what's not in the voting. All right,
Right on.
even better. All right. Okay. Folks that are voting. So a few have been involved with health needs assessments. Okay, that's part of the show later. So yeah, we'll be using laptops, and the last one, which will lead to the first presentation. Little word cloud
Oh,
activity.
Yeah, yeah.
Keep it clean. Do you want to use this?
Yeah, I
To
guess
move,
that
are you gonna move around?
I probably will.
Okay. And then you can tell me. Ooh. Man, I'm so glad that it works.
An unknown equity. Oh, good. abatement, fair. That's interesting. Well, I like this is presenting on the rest of it.
Assume equity was hit a couple times. That's what's changing. Sustainability, equity. Climate. Wow, that thing's really wobbling up there.
It sure is.
Oh, there we go, more. Unknown, sensitive, sustainability, ongoing, quality. Opportunity, abatement, okay. Don't be afraid to come up to the front.
We don't bite. It's not yet.
No. Speak for yourself.
Okay.
All right. Participant typing.
Ability,
Equity's big. That means multiple people have said equity. Yeah.
I like that.
Okay. Yeah.
I'm gonna try to.
Okay, how we doing? All right.
Are you guys ready?
Accountability.
Yeah.
You're rigging. You're like, what if I say that too?
Right on.
Awesome. All right. That leads right to environmental justice.
You guys ready to get started? All
There you go.
Thanks.
I'll be your tech support.
Okay, perfect, perfect. So, oh, did I pass one?
There you
I did, I passed one. So, what environmental justice means to you? And, you know, as the screen showed, it can mean a lot of things to a lot of people. This is EPA's definition of environmental justice. And how many of you have been to a presentation on environmental justice previously in the last couple of years? Okay, you've probably had this read to you a few times. I think one of the things that is my takeaway for our particular application is looking at the aspects of fair treatment and meaningful involvement of all people. So this means that we're bringing together our data, our ideas, and getting everyone in the community involved so that we can address the challenges and the needs that we find, things that we may already know about, but also things that we can glean from these data. And then I like that, you know, we have this goal will be achieved when everyone enjoys equal access in the decision-making process and having a healthy environment in which to work, live, learn, and play. Another important part of our lives. So I'm going to talk about 3 tools that I use primarily. And we're just going to dig into the data a little bit. I'm not going to do a deep dive into what environmental justice means to EPA or how it affects the tools that we're using, more or less just a hands-on with the tools. So what does this information provide to us in the context of brownfields, either ramp application preparation or creating a community plan or redevelopment plans? First, you can identify community needs. Then you can use these data to support your findings. You can propose solutions based on critical service gaps that you find or inequities that you find. And you can present your plans. You can use these to integrate into, for example, community outreach, and also to guide your narrative in your grant application process. So next, all right, diving right in. And you can follow along in your little handy dandy handout. And I encourage you all to, as we go through, to click on the links. We're going to do that together in just a moment. And for right now, I want to run through this a little bit. And yeah, Christian, get out of here. So I'm going to run through some of these slides fairly quickly.
This is why you want to sit up front.
And then we'll go back and we'll look at each of these tools together in real time. So EJScreen was created by EPA. It starts out, the landing page is an interactive map. It graphically displays a lot of data, socioeconomic data, health disparity, poverty, demographics, and some critical service gaps. The data are sourced from the American Community Survey, Decennial Service, Census, I have a hard time saying that, sorry, and other agencies. You can present, it can provide printable reports and data spreadsheets. You can download this data and do just about anything you want with it. So when I do an EJScreen search, there are a couple of different methods. For this example, I've dropped a pin. So I just randomly chose Arnoldsburg, West Virginia, because that's where my cursor landed for this example. I chose a pin, I chose a place, dropped a pin, and then automatically you're given the option of what to name it and also what your buffer is going to be. So the default is 1 mile, and that's what I chose. So once you've chosen your search area, you can, of course, again, search by, you know, a specific area. It doesn't have to be just a pin drop. You can go over here to maps, and there are a lot of options to choose from. And this is a graphical display, right? And for my example here, I've clicked on critical service gaps. And this shows that for this area, we are in the 80th to 90th percentile critical service gap for broadband access. Okay, so now we can just go back to our little drop down here, and we can click on, first of all, Explore Reports. And when you click on Explore Reports, you come to what most of us have been used to seeing on EJScreen for the last several years. EPA has updated EJScreen just in the last few months, and it's wonderful. The graphics, the report that it produces is just amazing. If you're at this page, you can, of course, get the data tables, so you can download it, manipulate it however you want to. I strongly suggest you don't change it, but then the next cycle here is to choose your community report. And so this is the first page of the community report. It's about 5 pages long, and we can look at that in just a few minutes when we go through this together. Again, graphically, it's great. Shows you a lot of things up front. It's a really great communication tool. And that's it for that one. All right. So the next one I'm going to talk about, and again, we're going to go back and go through these together. The next one is the Climate and Economic Justice Screening Tool. And this is one of my new favorites. It's very, very easy to use. It tracks things at census tract level, and it reports on underserved and overburdened communities. Really easy to access these data from here. The data sources are vast. You know, it's again, the American Community Survey, CDC, FEMA, HUD, CDC. Did I say that twice? Yeah. And the criteria, of course, for qualifying as a disadvantaged community is to rank in the 90th percentile or above in one or more of the listed categories, or to be above the 50th percentile for low income. So here I've, again, just, here's the landing page. You can choose by address. I tend to go to the Zoom because I think it's more fun. I've randomly, again, I promise, selected census tract in West Virginia. And you see when you click on the census tract, you see there are these boxes that light up. And anything that's highlighted in dark blue is an indication that a threshold burden has been exceeded. So if we open this up, for example, I've clicked on workforce development. And you can see that these are highlighted. They're telling us, you know, where these problem areas are. For example, this is in the 92nd percentile nationwide for poverty. We have a low number of high school graduates, 24% of people 25 and under have not graduated from high school in this group. So these are some things that we can keep in mind when we're looking at our redevelopment plans. Okay, census data tables. I am not an expert on this. Kristen can tell you so much more. So I know just enough to be dangerous.
I have a former student. in here.
Oh, awesome.
Yeah.
So I really try to keep it simple with this. The data here are a lot more granular. You get a lot of information out of this, but you can also be overwhelmed by it, and the tables are extensive. Default filters for the geography include the United States. I encourage you to always leave that one up there because you always want to be able to compare to the national level. You can include county, state. State is always another good one to keep up there. And then your specific geography. You can go down to census block group. You could do a county subdivision, etc. So the next bear in this circus here is choosing either a topic or a survey. If you know the table number that you want, that makes it easy. But if you don't know, it can take some diving. So if you have tables that you have found that you commonly access, I suggest that you write them down because I don't find the numbering intuitive. Do you? No. So, so again, you can choose topics. The American Community Surveys, they have the 5-year group topic or data. And I like to use those surveys quite a bit. Once you've selected the geographies that you want and you've selected the table that you want, you can export these to CSV, Excel, or zip files. And then you get these beautiful data sets that you can format in tables and present to whomever. Again, I'm scared of this one. I only use it when I have to. So we're going to go back and we're going to start with the EJScreen. Now I have to figure this out, right, Christian? Yes, tech support.
I got you.
Oh, thank you.
Make it easy. Then you can come back and drive.
Sweet.
Okay. EJScreen. Look at that.
Yes.
Magic. Let me make sure people at home can see this. Hold on. Dun, 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 dun.
Right.
And share.
Cheat sheet here,
Okay.
so I can follow.
You all don't see that though.
No.
That's fascinating.
There it is. Uh-oh. You broke it, pretty much.
But now,
Perfect.
okay, we'll be able to get back to that.
Okay.
All right.
Excellent. Okay, everybody ready? Excited? Yeah? No? Damn it. I'm bombing up here.
You're excited.
All right, where are we? Beaverton. No.
Oregon,
We're in Oregon?
I think, right?
I don't know.
Oh, Utah, wait a minute.
Where are we? Oh, how do you zoom on this?
There
Okay.
you go.
Yep, Portland.
There you go.
All right. So let's go somewhere else. Let's go somewhere like
Local.
East Coast, sort of. All right, my zooming technique is not working very well here. Well, we're in Kansas City, Indianapolis. We're getting closer. Pittsburgh. Oh, look, there's West Virginia. All right. So now I got to figure out how to zoom in. Oh, look at that. All right. So I'm not going to go belabor this too much. We're going to go to Spencer because it's right there. All right.
Anybody ever been to Spencer? Yeah. All right.
Awesome.
Yeah. That's two.
2 people.
Yeah, two.
Woo. All right. So let's see what things are looking like in Spencer. All right. I'm going to just because I don't really know the town. I don't know what's going on there. I'm just gonna drop a pin right in the center of Spencer here. Okay, everybody choose your own community. If you're following along, choose your place. All right, and drop your pin. Bang. Right? All right, let's see what's going on with Spencer. I spelled it right the first time. All right, so here we're just choosing that 1 mile buffer, all right? And we're gonna add it to the map. We're gonna add it to the map. I promise. There we go. And now I have to try the zooming thing again. Rats. Is it like when somebody's doing a video game and you want to help them, right? Okay, so again, like I went over earlier, you can come over here to the left to maps and click on maps. And this is going to give you some really good just visual information. You can look at supplemental indices, pollution and sources. This is always a good one. You can come down here and say, okay, what's our particulate matter look like in this area? And all right, so we are looks like we're pretty low here. I can't really tell. Not a good color. Not a good color for us. So let's go down here and look at critical service gaps. See what's lacking here. How about broadband? How are we on broadband here? Oh, 90 to 95th percentile for broadband access. That's a problem, right? That's something that maybe we should keep in mind when we're thinking about our application, our redevelopment plan, something that can really help the community. Okay, and not to belabor this too much more, we can go here and look at Explore reports. And again, this is what I was used to seeing with EJScreen. And the report that was generated looked a lot like this. Okay, so you can click through, look at different indices. Here we see wastewater discharge. Okay, we're in the 85th percentile in the state, 76th in the country. Supplemental indices, again, you have the option to click the state. Here we have supplemental indices saying that wastewater discharge is in the 95th percentile. So economic justice indices are available here. Again, you know, hazardous waste proximity, that's another one. Socioeconomic indicators. So I think this is an important one to point out. We have an aging population here. So we're in the 83rd percentile for people 64 and over. And again, that can be important when you're thinking about what you can do to help your community. All right, so here's the report. Loading. We need hold music here. Ah, it worked. All right. Thanks, Christian.
Well,
So this is just amazing. This can be exported just immediately to PDF. Really nice visual representation of these data. Has a lot of different indices and compares to the state and national levels. Health indices, climate indicators. And this is, EPA has done a great job with this. And I really like the improvements that they've done. All right, so let's move on to the climate and economic justice screening tool. So this is my kind of my new favorite place to play. This, you want to follow along. Again, you can search by an address here, city, state, zip code. These data are on the census tract level. So you can't be quite as selective on this, but it does give you some really good results. And I really, really wanted to use my zooming capabilities again. Let's see if it'll work this time. Ooh, superpower. Right on. And there is no way I'm going to find the same place. So I'm just going to randomly. Yeah, there you go. I'm just going to randomly click and see where we end up. Here's Rock Cave. Anybody been to Rock Cave? You've just been everywhere. Wow.
I might have been there. Oh, French Creek Freddy. Yeah. I may or may not have been road bowling in Ireland, West Virginia. Irish road bowling for those that know. Go ahead. Sorry.
That's a need to know. That's a need to know for
We
me.
can talk about that later.
Okay. So again, we're looking here, these blue boxes are dark and they're indicating that a burden threshold has been exceeded. Health, legacy pollution. I bet I know what that is. Let's see what's there. Look, surprise, surprise, abandoned mine lands. And low income, 86th percentile. So that's not surprising for that area. Again, these are good data to have to support your grant application, your redevelopment. There's a big push right now with grant money for redeveloping abandoned mine lands and incorporating renewable energy. So some good opportunities there for communities. All right, so I'm not going to play around with this too much.
Is that what makes the report like you just did with the other EJScreen?
You can do a data download, and it's really interesting because when you get the data, you can go to the download page, and you'll also get a shapefile that you can use. So it's very, very easy to manipulate. As far as your pretty printout like EPA does, it's not going to be the same. But I really can't say enough about this tool. I think it's great. So now, guess where we get to go? Ooh. Fortunately, some of this is already pulled up, so it's not quite as scary as it could be. Geographies here. All right, I jotted down a couple. Somebody call out let's do West Virginia again. All right, we'll compare to state level, West Virginia. Somebody call out a town.
Cassville.
Where?
Cassville.
Cassville. Okay. West Virginia. All right. Now we need to go back. See, this is a little cumbersome place. All right. And now we have to go through all this again, right? Yeah, that's new. I hadn't seen that previously. I clicked on that for North Carolina and there was no data there. And I assure you, North Carolina's rural. All right. And it does have to be all the way down to the bottom. West Virginia. All right. Cassville. Is that CASS?
Sure.
Somebody help me drive. Oh my gosh.
Yeah.
I really have used a computer before.
There you go. Cassville CDP.
Cassville, CDP. What is CDP?
Census designated place.
Should name it. Okay.
It's very small.
All right. So now what do we want to do? What do you want to look at in Cassville?
How about any
Topic or survey?
I can't see there, environmental sites that are impacting our water right now,
Well, I think what you're going to find.
or am I not in the right page?
I think those data are gonna be easier for you to find on either the EPA EJScreen,
Right.
because that's EPA directly with EPA, and they'll pop up and populate your site.
Okay,
Um,
just pick whatever.
Okay, then I'll just pick whatever. So again, you can choose by survey or topic. Again, community surveys, these are great. Topics. There are a lot of different rabbit holes you can go down here. Income and poverty, housing. Again, knowing which tables you're looking for is helpful. So for example, here, I've clicked on poverty, but we're not just gonna see one table for poverty. We're gonna have a whole selection here. And it's overwhelming to me. So let's just click on this American Community Survey, one of my personal favorites. I've used that one too. I'm not sure why it's called S. All right, so here we have our table, right? It's huge, it's clunky. You can come over here and click and look at, how many, what columns you have. This data is not available on that community level, that CDP level. Oh, you should be. It's terrible.
The US Census Bureau should. That's why it's better to download.
Yeah,
It's often better to download these data.
yeah. So anyway, let's just look at the table that we have here, and then there's an example. No, I did not put an example in here. We can, though, for the sake of time, just look at what the state and national levels are. So here we have poverty status according to sex, according to race, age, gender. This is all good information, things that can be used, income levels, and you can compare. This doesn't do percentiles the way the EPA EJScreen does, or the CEJS tool does. So you can use these data, you can download them, of course, Excel, CSV. Does anybody use that anymore? Yeah. Zip file. And then you can actually compare the data to each other, but it's not going to give you a percentile. You'd have to do a little bit of math for that. But it's very granular, a lot of different categories. They give you margins of error, the numbers, as well as the percentages. And these are good, great supporting data. Again, this is a clunky tool. If you have any questions, please ask Christian. And now I'm free. I'm turning it over to you.
Segue.
Yes.
What
Is that your phone or mine?
That's mine.
yours.
How
Okay.
much time we have here?
Did I run
Okay.
out of time?
That's all right. Let me go back, fire this bad boy up. So you're welcome to stand up, do a stretch while I get going, please.
Seventh inning.
Go ahead and get after it. That's fine. Slideshow from current slide. Okay, screen share, new share.
You're doing great.
I'm doing great. Okay. All right. There's Candy.
There's me.
Thank you, Candy. All right, so here's what we're gonna do. Possibly. Oh, talk to me, Goose. Talk to me. There we go. All right, I wonder if I have to sit here. No, good. Okay, so I'm gonna try to get through a few things today, and you have a couple handouts. I'll talk about those. So I'll talk about different sources for local public health data, kind of why you need them, where to get them, and community health needs assessments, what they are, who does them, what it typically looks like. Okay. Objective is actually for you all to start playing with your local data today. Okay. So I'm going to zip through this fairly quickly. It's important to ground us in what health means. And it's not just the absence of disease, right? It's complete physical, mental, and social well-being, and it's a right for everyone. So quality of life, was it Andy talked about earlier? Quality of life, without health, we don't have quality of life. That's where we are in the world of public health. Health first, quality of life subsequent. Okay. Some reasons why you might need health data. It's in your grant applications. They're in the, okay, I'm just gonna leave it there. That's easy enough, right? And I cite later exactly where. So if anybody has seen, this is kind of an abbreviated version of some webinars I did through TAB at WVU. But not only do you need the health data, you need to show how the Brownfield grant will reduce health burdens along with environmental, social, and economic burdens, okay? Why knowing about community, and the abbreviations, I say China, sorry, but so you might hear me say that quite a bit, but why knowing about community health needs assessments matters. That is one of the eligible uses of grant funds, assessment grant funds, to do a community health assessment. In the world of the IRS, which you'll see, hospitals and health departments call these community health needs assessments. Hi, Katie. Bucky is not with me. All right. Where's Bucky? All right. So quickly, finding local public health data. There are a number of state, county, and city level data sources. Many familiar with county health rankings, right? This is a good one. I will give you pros and cons. Again, I'm trying to get through this to get to the nuts and bolts here. Okay. What time do we have till 4:15? All right, we're gonna hustle. Okay. So county health rankings is really good because it shows you, it summarizes data, shows you relative to other counties in the state and against your state where your county rests. They do some math behind the scenes to kind of put that on a Z-score, like a standard score. Okay. We don't need to know about that too much. 4:30? Well, shoot, I'm gonna slow down just a little, Katie.
I don't feel so bad now.
Okay, it's like, whew. So some pros and cons of county health rankings. Okay. It does a very good job of showing the county relative to other counties in your state. A lot of county level analyses, a lot of folks like to see competitively where they fall relative to other counties. Okay. It highlights, there's an aspect of it where you can, and that's in the tool. So in the sheet I gave you, there's actually a QR code. You can hit that and watch much more extensive YouTube videos of me talking about these things. They're really fun. That actually were recorded for Uday, your class, I think, and I'm reusing those. So it's wonderful. You know, hit that like and subscribe kind of thing. Okay. So what's really cool is you can just click these two little boxes that show areas of strength and areas of weakness. So you can print out a report that says, here are the areas of weakness, things we can work on. It's only at a county level. That's one of the cons. So it might not be useful in grant applications in particular. The EPA has specifically noted 3 health outcomes: asthma, birth defects, and cancer rates. None of those are in here. Okay. So that's what it doesn't have. That's a big con if you're using it for your grant application. So City Health Dashboard is a really good one, really visually appealing. It takes like census data and these other wonky data sources, puts them in really beautiful maps. Okay, that's one of the beauties of this. It offers data on 40 different measures of health, and then what we would call social determinants or drivers of these health, like income inequality, poverty, education, things like that. It offers this up for over 900 cities. I think they just added 47 more. One of the cons that you'll see is that it's data for cities with populations over 50,000. Are there any in West Virginia? No. It adds in those states that don't have cities that size, it adds the largest city in that state. And it has also added some small towns. So I think Charleston and Morgantown are the only 2 in West Virginia that have data. I even have the map and it's been updated since I pulled this. But you can see, right, it's biased toward large cities. Okay, that's fine. It has really good data on those cities. The pros, it has, you know, a number of health metrics. It has cancer mortality data, right, which is deaths due to 2 specific cancers, breast cancer and colorectal cancer. It doesn't have cancer prevalence or the current rate of cancer, right? The number of people that have cancer in the community. That's the sickness of public health. We talk about death and disease all the time. Okay. But what you can do is identify vulnerable populations in this. You can put like 2 different measures on a map, which is pretty cool. And I'll show you an example of that. And it has all these different measures, and you can see the metrics that it does have for physical environment include some things like air pollution, lead exposure risk index. And of course, this is pulling from other data sources, right? That many might be on EJScreen and others. I just haven't played with those as much. And so what this map shows is when you put 2 different metrics together, in blue, you see lead exposure risk index, dark blue is worse. Children in poverty are the red dots, dark red is worse. You can see where the 2 dark colors merge, basically. This is Morgantown, different census tracts. Right through the heart of town, there's a power plant here, right? But you can see where these things merge together in dark blue and then the dark red dots, where there's high lead exposure risk and a high rate of children in poverty, okay? Really cool things you can do when you put 2 measures together on a map. And it's very visually appealing at the census tract level. Big cons on this, thinking about EPA, it does not have asthma or birth defects data. Okay, I already talked about the con of only having a certain number of cities in this. It gets a little wonky. Some measures are at the city level, some are at the census tract level, so you have to be careful in that, okay? But again, visually very appealing. So let's go to CDC PLACES. Okay, this is actually, working with Robert Wood Johnson Foundation, the CDC provided some model-based. So they did some behind-the-scenes small area estimation, basically taking a whole bunch of data, looking at areas, larger areas, and merging it down so that they have data for every city, every census tract around the country. Okay, it is not as visually appealing as city health data, but it has some really good stuff that you can play with. Okay, so that's what we're going to play with today. So it's cdc.gov/places. Okay, so if you want to start looking, has an interactive map, as you can see an example here. What it does have, current asthma prevalence for adults ages 18 or over, also prevalence of cancer among adults aged 18 or over. So this has the data that you would need for an EPA grant, okay? Strong pros on this, the entire US is covered, okay? Yes, they do some small area, some estimation behind the scenes, but every place is covered, has asthma and cancer prevalence. You can zoom into the local level. Birth defects data, that is really hard to find anywhere in the US, quite honestly. Some states do that, some hospitals do that, but US wide is almost impossible to find. Okay, so state level, you might get that. What you can't do is do that vulnerable population, putting 2 measures on the same map kind of thing, which is unfortunate. So time for a quiz for you all. Okay, deep breath. So go ahead to your town or area if you have, it might be tough on a phone, but see if you can go to cdc.gov/places, look up the census tract or the name of an area that you are from or where a brownfield exists. See if you can find the asthma rate. Now I'm going to go over to the website and show you some tips if I can, and it's not going to share. So let me close this. We're getting used to this. Okay. Nope.
Sorry.
Nope. There we go. Screen sharing is stopped. Okay, thank you. I'm going to share the screen we're on for folks at home. Okay, you ready? So the way to get into the map is click interactive map. You get a warning and you move on. Okay. Once you get in here, you'll see, if I can move this out of the way, we have across the top, the big categories of data: health outcomes, prevention measures, health risk behaviors, disability, some health status outcomes, and help. So You can look through the different ones, but a lot of these are pulled primarily from CDC national data sets. Okay. So if you're on health outcomes, asthma is there. So is cancer. So we click on asthma. It does get a little wonky. So if you scroll over to the right side, if you can see the cursor, which you probably can't, whoa, no, don't go back. Click on the magnifying glass and search for a place. Let's go to Wheeling, West Virginia. Okay. And now what this will do, you have an option to kind of slide this over. Uday, is this ArcGIS? This is ArcGIS, right?
It's some app. There's a tool.
Okay. Uday is an expert in this. As a student in my class, he showed me a thing or two. Okay. So in here, what you can do, you'll see dots, which will give you a city data result over on the right here. You get rid of this, hopefully. Okay. So it gives you the full city data. It highlights what area you're looking at. It has some arrows up here that let you scroll through the different like census tracts you've picked. And it'll tell you the rate. In this case, we're on arthritis. Estimated prevalence of adults with arthritis is 41% in this small census tract. So that's pretty nasty, quite honestly. So if I click on asthma, we go back, it takes you back to Wheeling, and you can click on the dots. That actually gives you city level data. So Wheeling City, and here you scroll through, gives you the actual number in this tract. So it switches back and forth between the tracts and the city, so be careful. But 10.8% prevalence of asthma in that census tract, 11.4 there. And overall for the city of Wheeling, 11.5%. So through this, and if you just look at the map, you can see the darker colors are worse. That's one way to visualize it, okay? And so does anybody tried it with their local area? What do 10.5, you were able to get there and find it easily. Awesome. Asthma would be good. Did you find a different one? 12.9, okay. 11.9. So yeah, you can start clicking on different census tracts and seeing where it varies. So if it's near a brownfield, right, you can show, if it's downwind from a brownfield, if it was a power plant or something, yeah, you can find some good stuff there. Okay. All right. So the point was to introduce you to that. All right. I'm going to go back and get to some community health needs. We're just going to look at your picture, Candy.
Oh, lovely.
Glamour shot. Okay, we're going to start from here. Yes, help your friends. Current slide. All right. So the last thing in just a few minutes is to talk about community health needs assessments. Those of you online, I'm going to switch the share just a second. Okay. All right. So that's in the way. Okay. Community health needs assessments. Talk about what they are, who needs to do them, and what you can get from them. Okay. This is nonprofit. So there are two key partners in this. Okay. And I know just a few of you have worked through this before. So, and I was talking to Juan earlier, who's interested in this. So nonprofit hospitals, as a condition of their nonprofit status, have to do every 3 years a community health needs assessment and improvement or implementation plan. What these are, essentially, I'll talk about this in a minute, but through this, it's really pushing hospitals upstream from care, like sick care, into addressing these social determinants or built factors that are driving health outcomes in their communities. It's, and what they do is they talk about community benefit, and that is what hospitals provide to benefit their communities other than the reimbursed medical care they provide. right? They can write off unreimbursed care and other things, but this is a huge, huge industry in the US. And I call it an industry, but I mean, that's the way to look at it. So in this chart on the right, this was prepared by the American Hospital Association from 2022. 51 billion in the dark blue is unreimbursed care that they get reimbursed for by Medicaid, Medicare, things like that. $60 billion is other community benefit. So this is what they can do in communities to address health issues that I identify in the health needs assessment, okay? So it is a huge thing in the community. It can be, and they can be a tremendous partner in brownfields redevelopment, okay? The other potential partner are local health departments or just health departments. If you have a local health department in your area that's seeking accreditation, so hospitals have to do that cycle every 3 years, health departments every 5, if they're going through accreditation, which is a big deal for health departments. There are 10 essential public health services in the world of public health. On the far right, you probably can't see it, but in the red are the assessment pieces. So health departments have to do health assessments too. Great partner for brownfields work. And so in those key measures, what they have to show is the capability to do a community health assessment, collect primary data, participate in data sharing with other entities, critical. So in Mon County, where I'm from, the health department and 2 hospitals work together on a community health needs assessment. Same thing in Kanawha County down in Charleston, West Virginia, okay? And so it can be a huge multi-entity coalition that works together. Okay. What does the process, geez, we're running out of time. So the process typically looks like organize, get a leadership team together. That's an opportunity to infiltrate, collaborate. Typically you review the past 3 years, what the hospital has done, what it hasn't done, assess the second step, gather. So I've done this multiple times in multiple WVU hospitals. So this is kind of our process, and most processes look like this. Use existing health data, gather new health data, get community input and prioritize a health need or multiple health needs. And then once you do that, you finalize it, you have to put it online. You have to make it available to the public. So that's what you need to go find to see where they are in the process. Once they figure out on this prioritized phase what the health need or health needs are that are prioritized, they have to go do something about it and create a plan for going to do that. That's the implementation phase. Unique things like super users, individuals living without stable housing, right? That often show up repeated times to the ER. Mayo Clinic and others are building housing, right? Because housing first, then you address the health needs. And it shows that you're addressing that. So an example. So in these slides on the left side, you'll see my suggestion to how to go find your local health needs assessment if there is one, if there is a nonprofit hospital. We worked on the Ruby Memorial one back in 2019 and 20, actually the one before that too. So you can see they publish online their 2019 community health needs assessment, and actually the following year they did the implementation plan. Okay, so I suggest search for your hospital name and then the words community health assessment or community health needs assessment. Look through the table of contents to see what data they used, because you could use that, right? Whether it's existing data, so secondary data, and or the primary methods of data collection they used. Some hospitals do a focus group of their nurses to see what the priorities are. Others go fully out in the community and figure out through a number of focus groups with community members, much more community driven. I think we were talking about Kentucky, you doing that. And so some go whole hog into it, some just do the bare minimum. Usually if it's run by a public health agency, they are out in the community doing the good work, getting their fingers dirty and getting primary data that way. You can see from the one we worked on, obesity related chronic disease was number 1. So at some point, probably toward the end of the health needs assessment or the executive summary, they list the priorities. They should. Obesity, chronic disease, substance use and mental health issues, and cancer were the top 3 in this exercise that we did in Mon County. Okay, so that's just an example of a nonprofit hospital. So I encourage you in that they will also list their catchment area or the area that they are addressing through the health needs assessment, usually at county levels, okay? So look for your county or counties in that, or the area where your brownfield activity that you're looking at is. Here's a local health department example from Cabell County, Cabell Huntington Health Department, where Marshall is. I might be looking for a job at Marshall, who knows? Sorry. Yellow and blue makes green, right? That's the joke, right? Gold and blue makes green. No. Okay. So this is an example. They follow a very similar process typically, but it's every 5 years. Okay. Same thing. Look through the table of contents. They use secondary data, existing data sets that I showed you already. They typically use county health rankings. They did in this one. And then what the priorities are. So prioritization process and description of prioritized needs. And they took it visually this way: COPD, diabetes, mental health, physical activity, which is my favorite. We're bike riders. So, you know, when they talk about the Paul Ambrose, the path, the trail in Huntington, some of that work is funded through like their local hospital and others because it's identified as a priority. All right. See if you can find your local community health needs assessment. My challenge to you, young data heads, young grasshopper, and that's it. I think that's all I got. No, not great, but
I'm sorry.
no, it's good. It's good. Oh, that's right. It's 4:30, not 4:15.
Yes.
I got a bonus. Okay. So see what you can find. And if you have a phone, you can probably find it. So look up your local hospital. It has to be a nonprofit hospital, not a for-profit. That's one of the keys. And let me know what you find. WVU covers? WVU and UPMC.
Does everything you medicine do this for all the hospitals if they run?
Yes, they have to. I was part of the process.
Fabulous.
Yes, I was part of the process for a bunch of them, but have handed that off to others now. So yeah. So raise a hand or let us know what you find. And once you get there, find in page priority. Some of those letters. Well,
Yeah, they didn't have one yet then.
well, that's, yeah, I don't know if that's back down, right? There are a couple weeks ago. I was just here, anybody else having some luck finding theirs? I mean, UPMC, right? One, we got UPMC, Allegheny Health Network around here. You find priorities in it? And what county is covering? Yeah, it's not. Yeah, I would. So part of the IRS regulations is you have to have it online. You have to show like some kind of evaluation of progress every year. Now, the enforcement of that, right? You're smart because the enforcement of that is iffy, but they were starting to crack down on it a little bit. They could lose their nonprofit status if they really flub the process. In the past, they had used consultants like from, I mean, you have experience, they had used like their, not Wells Fargo, but like some of the Fortune 500 consultants on this. Once they started to shift away to that, because it's much cheaper typically to work with the academic unit, public health folks. We don't overcharge you typically, right? And they get the whole social determinants going to actually you need to speak to the residents of the community that are facing these inequitable conditions. And so that's kind of what we do in public health. We're your social justice warriors typically, right? So if you want to get your MPH, come talk to me. That's my plug to President Gee, who, if he's listening, I'm sure he's in the wall somewhere. We're trying to bring in more students.
Sign me up.
Yeah, we got one. So does that make sense? Anybody struggling with this, or does it's intuitive, but what the thing is, maybe if you're going for an assessment grant, the local health department and or local nonprofit hospital would be a great partner in that, okay? Or if they've already done it, you can go to, and you see like asthma, like actually Morgantown has really high rates of asthma, you know, downwind from numerous power plants, you know, on the Ohio River and just outside of Mon County, asthma is really high. And so if the hospital said that, then it's like, okay, let's talk about housing too, right? That they maybe, you know, that may be an issue for especially asthma among children, right? And bad housing. Yeah,
Just have a question.
please.
This is just the distribution of the data, correct?
Excuse me?
This is just the distribution of the data, correct? This GIS map. Yeah.
For the CDC, the PLACES website?
Yeah. This is an average distribution of the data, correct?
How do you mean? Tell me, reframe that question for me.
In terms of statistics, considering the you know, how much cases covered the need of that.
Right, so look at
In relation about the causation of the.
right, it does not give you causation. No.
So this would be maybe we can some a lot of people.
And smoking, you got smoking, housing, coal-fired power plants, you got it all, you got a lot coming into it, yeah. So it will not tell you what causes it, that's the nitty-gritty epidemiology kind of work, right? It typically gives you the prevalence rate, the current rate of how many people, what percentage of people have whatever condition you're looking at, or the percentage of people who had, you know, more than 5 unhealthy days in the last month, physical, mental, you know, that kind of thing, yeah. But any of these sites, and I always warn students, click on what the measure is itself. Because if you just say, well, it's mental health. Well, if you don't click on it, you don't know it's a number of days in the last month, right? Where people reported, you know, poor mental health that kept them from doing their activities in daily living or something, yeah. Good question,
Also,
thank you.
that gives you a little, without the causation, it gives you a little flexibility to confirm your application about how you're gonna solve it or approach it.
Right, yep. Yeah, for sure. So yeah, that was a quick run through. Like I said, that that front and back, this is a sheet, actually a cheat sheet. You might remember this, but it's a cheat sheet that I kind of updated a little bit and have hit the QR code. You'll go to YouTube for a playlist where I've, you know, 3 videos where I'm going through the websites I mentioned plus others. Some are state level data, so I didn't even bother with those. The adult health stuff, BRFSS from CDC, and the youth risk behavior stuff. I focused on the county and city and census tract stuff for that. Okay. And you also have that EPA, you know, information about community health assessment. So hopefully this is helpful. If not, you can come up and slap me, that's fine, but don't slap Candy. Candy will fight back. Sorry. But yeah, if you have questions, let us know. This is the crew up in Morgantown. And that's all we got for now, I think. What questions do y'all have? Yeah.
So you said that the hospitals will do these needs assessments, but will, like, if there's not a hospital in the county, would a health department do one, or would you just expect there wouldn't be one?
You know, what hospitals can do is cover multiple counties. So Parkersburg, right, the hospital there, they covered, it gets very unwieldy, but they actually went with the whole mid-Ohio Valley, like to match the health department. So 10 county area, because hospitals will see people from many different counties, right? They'll call their catchment area, or I forget the other term where they talk about their clientele, right? The people that come to see them, including they went over to Ohio, a couple counties over there. So it's where they see a lot of patients from. And before you go on, they define that, they need to define that early in the process, what region or counties or whatever they're going to cover, and the health equity issues too.
And
Yeah,
that all should be in the report.
it should be in the report. Yep. Thank you. Good question.
WVDEP takes over a hospital, do they do a new one?
They will have to do one. If it was a nonprofit hospital, they are supposed to stay on that 3-year cycle. When they took over Nicholas County, Summersville area hospital, they were right up against the deadline. So we had to do one in like 2 months. Typically the process will take 6 to 9 months because they also have to have like a 30-day comment period. So we had to hustle through that one. I remember that one. That was wild. What's the hospital near? When did they take that one over? So if you go, honestly, if you look up WVU Petersburg Health Needs Assessment or WVU Medicine, they have one page, I think now, that has all of them on it. So yeah, WVU Medicine, Petersburg Health Needs Assessment. That was that tip on that page of how to search for it. So I'm happy to talk more like one-on-one and yeah, get in touch with us, go through Carrie and Brownfields Technical Assistance Center. Yeah, I'd be happy to walk through your local area with you. It's kind of fun stuff, to me at least.
Also, what's the extension did a community review assessment got published in March of 2022. I think they may have those for county, but I know there's an aggregate report for the state.
Okay, yeah, that's right. All right. Extension's always a great partner in local communities. There you go. All right. Rumors, scandals, allegations, let's hear it. No, it's good. Yeah, thanks for your attention. Yeah, it's a tough one. Hopefully you got some. All right. Thanks to everybody out there in Radio Land. Hopefully it worked out for you.